Hi, this is Stu, and today we're going to look at low back issues, and in that low back we're going to include Quadratus Lumborum, which for me crops up a lot when I see practitioners, and we'll explain why. So let's start with the low back as a whole, and what I mean by that is that center column, the lumbar area, and close to the spine, which would be the muscles there would be the erector spinae muscles. We also have some small muscles around the vertebra themselves, and of course between each vertebra there's lots of ligaments as well. So how do we strain, or if it's muscular, or sprain if it's ligament, around that sort of low back area while we're doing the yoga practice? And really it comes in that particular area for me mostly from the forward folding, and it comes from the fact of what our intention is. If we're looking towards opening the backs of the legs, which generally we are in these forward folding positions, then it's no point in bending our upper body, that's not going to affect anything below the hip, it's not going to affect my hamstrings whatsoever, We need to be thinking about the pelvis moving forwards, and we're not necessarily going to aim this at the advanced practitioner. The way that they might do their forward folding might be slightly differently, because what we're going to say then is that after a certain while they don't want to be pushing those sit bones back too much. They need to be then maybe creating a little bit of a counter curve, But for the majority of people that are not super open, then we need to be thinking about moving the pelvis forwards, But at a certain stage, it will stop, And really, for all intents and purposes, that is the end of our forward fold, As soon as my pelvis has stopped moving, then anything else I do is coming from above there, So it's not going to influence the back of my legs, What it will influence is my low back, So when we're forward folding, in whatever position we're in, whether we're sort of standing, whether we're here, whether we've got one leg like this, whether we've turned it the other way, we're trying to access, first of all, we have to say, why are we bothering to change our legs, We're trying to, so if I'm putting my leg like this, or maybe I'm going to have it like this instead, or maybe I'm going to do it like this, why am I bothering to change this leg, or that leg if I'm doing the other side? Is to access different parts of the hip, So if that's the idea, then we need to think about, it's not all about coming forwards. We need to take our focus towards this hip and what's going on, and can we notice the differences, and can we work deeper into that hip rather than being too obsessed with always getting our chin to our shin, So with those things in mind, we need to think about, how can I make it better for myself? So if I feel that I'm already in this position slumping and falling back, then I need to lift myself up. I need to get a cushion under my bum or some folded mat under my bum, so as to make it a little bit easier for me to come forwards, Because then once I'm in this position, then I can feel gravity actually helping me come forwards. So I want to be able to keep as much of a neutral spine as I can, and then I'm just coming to where I can come to. And really, it's okay to hold on, It's not that you can't hold and you can't pull. But if you're going to pull, for me, I think you need to keep your chest up and create length rather than pull myself down, Because that's really not helping at all, And the more I curve, the more strain that is going to put on my low back. Those of you that have done quite a bit of yoga, maybe done some restorative practices, you might say, well, hold on a minute, in restorative practice they put some cushions on my legs and then we're folding over the cushions, and they don't care whether my back is rounded or not, because the issues are different there. I'm supported, I'm not pulling, and we're actually trying to create some length in the whole back line, so it's a much more relaxed. So the problems happen for the low back is when you start to load it, Maybe there is also some issues in those rounded positions if you spend a hell of a long time in them, But for the most part, we're talking about those particular active postures where we might be trying to encourage ourselves forward, but not taking care of our back. So for me, that's where a lot of the issues happen around this sort of low back area in these forward bend positions, yeah? It can also happen in back bends, and we'll also tackle why that might be next step on, yeah? So, forward folding, watch what you're doing, keep as much of a neutral curve as you can. If you're down here, yeah, and I'm not going to do it now because I haven't been warmed up, but if you're down here, then of course you can bring your head to your shin because there's only a minimum amount of curving. But what we want to do is be realistic about what is happening with our body and where our hips have gone to, yeah? If they're still back here, there's no way that my head should be anywhere near my shins, yeah? So how can I go about accessing a little bit more freedom? And we'll talk about this when we look at the bit about opening the hips and maybe opening the hamstrings, and I'll be talking about my favorite hamstring openers because they're actually much safer for the back. These are not the best ways to open your hamstrings because of the fact that you've got your back that can be brought into it. So we'll talk about those later. For the moment, just think about what am I doing? What am I trying to access, yeah? Here, not here, okay. Let's swap over then and say what happens when I bend backwards. I feel fine folding forwards, but when I come out of my back bends, I think, oh, that's not so nice, yeah? What's happened there? The spine is mobile in certain places more than others, okay? And it's those places where it's more mobile that it's more vulnerable. And if we work our way down the spine, we'll forget the cervical area for the moment because we're talking about the bottom, but we would thinking of the thoracic area, so everywhere there's a rib, there's a thoracic vertebra, and we number them from the top to the bottom, and there's 12. So it goes T1, T2, T3, all the way down to T12, yeah? Where T12 then meets the first of the lumbar vertebra, L1, then there's a little bit of a transition in the way that those vertebrae meet each other, and it's too much in depth to go into in this little video, but take it from me that there is more mobility there. And then it goes from L1, L2, L3, L4, L5, and it meets L5, meets the sacrum, the top of the sacrum, L5S1, and there's more movement again there, okay? So those are the very areas where there's more mobility and more chance of getting injured. So we have these areas that are a little bit more mobile. We have T12, L1, L4, L5, L5, S1, yeah, and those are more mobile. Now, if you're doing your back bends and you're taking the bend into those areas, then over time you're going to start stressing those specific areas. And you'll notice that in somebody when they do an Urdhva Dhanurasana and there's a sudden change of direction at the bottom of their rib cage, yeah? And so instead of the curve being spread, and of course this part of the rib cage doesn't extend, which means going backwards, doesn't extend that much, but we're trying to smooth it out. But if we have those sharp changes in direction, then we're throwing the forces into those particular bits. So it can happen there, and it can happen at the bottom between the sacrum and L5. So if there's a big hinge there instead, again, there's a problem. So what we want to do is to create some, if you know that's the sort of thing that happens to you, then you want to create some tension across the front of the body. Yeah, so drawing the rib cage towards the pelvis will flatten out that curve, and don't walk your feet in so far. So it won't be so high, but actually it'll be much healthier for your back. Yeah, and if you read the stuff or watch the stuff by, say, Doug Keller, who's a sort of well-known anatomist, he will say it's not these great high flourishing back bends that are good for you, although, you know, there might be more of an emotional release and energetic stimulus to the nervous system. But as far as the health of the spine goes, it's those lower ones, maybe like the cobras, the shalabasanas, that are actually more strengthening, more stabilizing for the back. If you read the stuff by Stuart McGill, he's a professor and his speciality is backs. He will say that most often it's not the people that have got tighter, say stiffer backs that are actually those in pain, it's quite often those that are actually more mobile that suffer more pain. So although we want to do these postures, we need to think about how how it's affecting our body, yeah, and we want strength, basically. We want strength when it comes to back bends is going to actually provide more stability in the back and actually make for a healthier back bend, yeah. So if you are experiencing pain as you come out of back bends, basically don't go so deep, engage the front of the body. If we think of the next popular issue, which is stuff to do with the Quadratus Lumborum and how do we feel it, how do we sense it? The Quadratus Lumborum sits in here between the bottom of the rib cage, the top of the pelvis and the spine. Yeah, it's a four-sided muscle and its job is it's a lateral flexor of the spine, so it takes you sideways if it works unilaterally, just one side. If both sides work together, it stabilizes the lumbar spine, okay, so it like fixes us in place. A lot of people I see on the massage table come to me with both of those muscles in spasm, yeah, and they're getting that pain across the low back, just a little bit like the belt area, the corset area, shall we say. And what's happened there is quite often after a back bending workshop or something like that. And the body has been, you've been going into back bends, and then the body is saying, oh my God, I've had enough of this, please. So it stabilizes that whole area by spasming both the QLs, and that can radiate sometimes down into the hips, but generally all around this area of the waist feels real achy, yeah. So how do we accommodate it and what can we do about that? First thing is that we need to start trying to get it to relax, yeah. So nice gentle side bends will be good for trying to create some space here and trying to get the Quadratus Lumborum to lengthen again, yeah. Simple supine twist, so lying on your back and then taking your legs to one side and taking your hand to the other and laying out like this. Again, we're creating a nice little stretch on Quadratus Lumborum. But all these things need to be quite gentle if you're actually got a QL that's actually really tight and not very happy at that particular time. And you gradually build it up more and more. The other things you might notice, which will be an indication that you've got a tight Quadratus Lumborum, is if you can rotate one way more easily than another. Yeah, if you're twisting to this way more easily than you can twist to that way, then it's normally, if I'm twisting to the left, then it could be the QL that's on the right that's actually restricting me from going that way. Yeah. So, and the same with the side bending. If you can side bend much more easily one way than you can side bend the other, then the chances are that you've got one QL that's tighter than the other. So then you get that asymmetry between the postures. Whereas if they're both tight, then you can just feel that actually I can't really move this part of my spine at all. It's all very rigid. And when you come to do an up dog, it's more like an upward facing plank. Yeah, that whole body, the whole back body is just stiff and rigid. So again, be very comforting with it, be very gentle with it, create some mobility, and then I think you'll find that that will just sort of loosen up, yeah? If you want to feel it, you can get your fingers, and from there you can, normally you'd have to actually be lying down, because here I'm tensing my back muscles to keep me up, but if I was lying down and I'm pressing in from the sides, you can feel it before you get to the erector spinae, you'll feel it a little bit deep there, just between the ribs and the iliac crest, yeah? So with all these back issues, again, you need to just look at your posture, how you're sitting. If you're sitting in a chair 24 hours a day in a slump position, yeah, and then you go onto the yoga mat and you're wondering why your back is giving you trouble, it's not the time you spend on the yoga mat, it's all the time you spent slumped in a chair, yeah? So rectify all those things outside the practice and you'll find that it will have ramifications inside the practice. Good. Okay, so next time we'll be moving up the body again and we'll be coming to the shoulders. So until then, take care of yourselves and I'll see you soon.